Tonight we're going to discuss with Dr. Linet, psychiatrist, movement disorders.
Hi, I'm Les Linet. I am a physician specializing in child and adolescent psychiatry, board certified in that, and also in adult psychiatry, and licensed to practice in New Jersey and New York. We're going to talk about movement disorders. The most dramatic and famous one is Tourette syndrome, and it's most famous for one of its symptoms, which I want to emphasize is not always present and not necessary to make a diagnosis, but it's the one that draws the most interest and fascination. The condition is Tourette syndrome. The symptom that I'm referring to is called coprolalia. That's the involuntary swearing. But what is involved with Tourette syndrome is multiple motor tics and vocal tics. The vocal tics do not have to be swearing. They don't have to be words even. They can be little sounds like and motor tics are stereotyped, meaning it's the same movement done over and over. Doesn't have to be one right after another, but you see the same twitch, the same shoulder shrug, and it becomes part of who that person is. They keep doing that.
What's the youngest you've seen, or most people have seen, who diagnosed Tourette's type syndromes?
Well, tics are not uncommon, but in young children, but often they are transient. Often pediatricians will tell the family, don't worry about it, it'll go away. And they're often right. Once a tic lasts for a year, it's generally lifelong, and it's then a tic disorder. There's a condition called transient tic disorders, but they're by nature self-limiting and disappear.
If the diagnosis of Tourette syndrome is made, is there any treatment for it?
Yeah, there is treatment. It's in this condition. There's a balance between the adverse effects of medicine and the benefit. So it depends on how severe the tics are. Some people's tics, you live with it. It's a personal choice. It depends on how bad it is. Some tics are very socially embarrassing, and that's a problem. Some tics cause pain because the same muscle is being used over and over again.
From your experience in your practice, have you ever heard anybody getting help by behavior modification techniques?
I hear about it, but the more systematic studies don't support anything as actually being effective other than medicine, and the medicines we have are not great for treating this. I mean, they can be very effective, but they all have
Can Tourette's get worse with time or better with time?
It can get worse. It can be either. There's a tendency for tics to get milder over time. If we look at people who are between 10 and 20 versus 20 to 30 and on each decade, we see the tics are a little milder with each decade. So that does happen. But there are also cases where the tics get worse.
Are there some kids who get a movement disorder that looks like Tourette syndrome, very close to it, and it isn't Tourette syndrome?
Well, there are other movement disorders. I saw a youngster who played basketball for high school, and in my office he would often jump up and touch the ceiling. Now, what I'm about to explain, most people don't know about, but you'll know about it. That movement, that jumping up and touching the ceiling, doesn't look like a typical tic. Now, the way that you tell whether this is a tic or a compulsion because you can do things that are compulsive. Just another quick example. The Tourette Syndrome Association had an educational video. It was years ago. I don't know if they still use this one, but on that tape, there's a brother and sister with Tourette syndrome, and the boy is younger than his sister. And at one point, while they're being interviewed, while she's talking, he makes motions like this towards her head, doesn't hit her, towards her shoulder, and towards her waist.